Hi, everyone, and welcome to our Greening Healthcare webinar. This is our final webinar of the year, and it's our year-end celebration. And I think it's also the first webinar where we've booked 2 hours for this because we've got a lot of speakers and a lot of great content, all focused on sustainability in healthcare. We're going to start off with a few keynote presentations and then get into a discussion around some key themes such as sustainability in new hospital planning, green teams, as well as anesthetic gas recovery to involve the clinician staff. Before we get started, I just wanted to start with some housekeeping. Please do interact with us through the Q&A. Don't use the chat function. We tend to save that just in case people are having issues with the software. That way we can post the comments also and responses to questions. They'll be monitored and answered by Ambi Thiel, the Executive Technical Director of Climate Challenge Network. And also thank you to our sponsors, Enbridge and ISO, for your support of 2020, and looking forward to working with you in 2021. And with that, I'll pass it over to Ian to start through the agenda.
Thank you, Michael. So can everybody hear me okay, Michael?
Yes.
Perfect. Okay, so we got a big program today. We'll dive right into it. I think everybody's seen the agenda in the announcements that have been coming out periodically over the last couple of weeks. We want to really have an in-depth leadership conversation, and it's a conversation with everybody on the line as well. So I do encourage you to please do use the Q&A function in the webinar to pose questions either to everybody on the panel or to anybody in particular, and we'll try to get to as many of the questions as we can within the program, and those that we can't, we will follow up with. After the event, the last 15 minutes, we're going to devote to the plans for greening healthcare in the coming year and what the big themes are, and we need some feedback. We'll have a bit of a poll of everybody on the line to let us know what are the areas that are most important to you. So let's dive right in. The 2020 program for greening healthcare, it has been the best year so far in terms of participation and in terms of results. On a technical development side, we brought in a number of major areas around the low carbon heating plant, continuing looking at new hospital performance. We had the pilot project with Alan Kelly at Markham Stouffville Hospital on really, for me, interesting areas of how much the performance of thermal recovery wheels, enthalpy wheels, can be improved, better controls and better maintenance. We've looked at top performing hospitals. We've recognized that the hospitals with the big savings, and again, a highlight for me in the last year over this past year has been the number of member hospitals and industry players that have stepped up and been part of the presentation. So we've enjoyed 2020. The results in the year, this is again our biggest year for savings ever. For 2020, just the calendar year 2020 compared to the prior year 2019, we topped $4 million in savings in a year for a single year. And if we, Michael, then look back over the past 5 years, if we move the baseline back 5 years, we were pushing $10 million in savings during this year. So these are real numbers, big numbers, and to all the members, if you're not getting your share, then 2021, we want to help you make sure that you make all the improvements that you can and deliver utility cost savings, because as we'll talk about today, for a number of reasons, those are going to become increasingly important over time. So good year in 2020, and so looking back, we did. Looking where we're at today, some of these graphics you've seen before. So back in the summer, we shared this visualization from the Hamilton Spectator, which captured at the time, almost a year ago, really well, the idea we're somewhat consumed with COVID at the moment. There's an economic fallout from COVID that's coming, and the big wave of climate change is still in the background. It hasn't gone anywhere. Delighted to have Kathy Gerwig with us today, and our feelings go out to everybody in California who's living with wildfires. So the climate change is still all around us, and that's a piper that's going to have to be paid as we come through. Interestingly from this for us, the second piece, we're not seeing so much recession right now, but the economic consequences for hospitals is happening in two areas in Canada. One is a massive outflow of infrastructure funding, which will, as part of the economic recovery, that will undoubtedly have very short timelines and limited time for planning. And we have a great interest in making sure that all the hospitals are ready to spend that money wisely. The second, I guess, side of that is that operating budgets, especially in the public sector, are likely to be constrained for the foreseeable future as governments look to repay all the money that's gone out during this period. So these waves keep moving. COVID, hopefully, we're about to face our darkest few months as the second wave is absolutely with us, but the vaccine hopefully is an end in sight. The economic wave is coming, and it's going to affect hospitals in a couple of different ways, and climate change still needs to be addressed. Our interest, as always, is what are the things that we can do that will address all three of these? What are the win-win-win solutions? Moving on to my friend Winston, who back in the kind of darkest hours of the Second World War is credited with this quotation. Some people wonder whether he actually really did say it, but it's a great thing to say anyway, like never let a good crisis go to waste. So we have three crises in play, at least three crises in play simultaneously right now, so we can't let them go to waste. Greening healthcare, we do believe that when Humpty gets put back together again, when all of this comes back together, it can be substantially better than it was before in terms of the environment, in terms of climate change, in terms of social equity, in terms of all the things that weren't quite right in the world before. Now, when everything kind of goes to pieces, as it has right now, when it's reassembled, which it will be because humanity is endlessly ingenious, when it gets put back together again, it can be a better world, and that's what we want to help everybody plan for, a better healthcare system coming out of these crises that we're going through right now. And my last thoughts before passing over to Kathy is, again, really about setting the stage for the day. We, as you know, at Climate Challenge Network, we work in a number of different building sectors, and we're having these conversations with municipalities, with governments, with big utility companies, with school boards. And the common theme is that the sustainable future is not easy, but it's inevitable. There is no alternative. We don't have a plan B. We cannot have an unsustainable future because it's unsustainable. But it's going to be very hard to get there, and we should recognize that hospitals are going to be at the forefront of where this is going. They're kind of in the crosshairs. They're centers of community. They're seen to be environmentally challenging in terms of managing all the things that hospitals are required to do, and we're going to get into that in a big way today. And the other reality around sustainability, it requires doing things differently and doing almost everything that we do differently. So you'll hear these primary themes coming out over the course of today and in the program for greening healthcare in the year going forward. So important day. We hope it will be an uplifting day. We hope it'll be an encouraging day. We hope it'll be kind of content that you can go into the holiday season reflecting upon and coming back enthusiastically in January with plans for a better year than we've had in 2020, and for real progress on all of these fronts. So let me pass it directly over to Kathy. We're thrilled to have her back. You'll recall Kathy's keynote to us a few years ago at the Greening Healthcare Forum in person in those days, and a lot of contacts there. She met with Westpark and various other groups during that visit. And Kathy, can we pass it over to you to update us on Kaiser's relentless march towards net zero?
Yes, thank you so much. I'm going to steal the screen from you
Please do.
now.
Yep.
And give me just 1 second. There. So can you hear me and see that slide okay?
Absolutely.
Great. Well, thanks so much for bringing me back to the group. I enjoyed our time together when I was able to visit, and really look forward to the work. I just mostly in this presentation want to build on everything that Ian just shared, because what a year it has been. But before I start, I did want to make a bit of a disclaimer, and that is in the huge global year that everybody has had. Personally, I made one big change, and that is that I retired from Kaiser Permanente. It had been long planned, and little did I know that pretty much the day I retired is the day everybody would go into lockdown because of the devastating pandemic. So what I'm going to share with you here is as an independent person, not as a spokesperson for Kaiser Permanente. So that said, just reflecting on the year, as Ian said, I mean, the pandemic, obviously, we also had very stark examples of systemic racism and social injustice. We had the deadly wildfires and hurricanes. And as I think about that, healthcare leaders are in a very unique position to make a difference in all of those realms, in treating disease, in addressing social equity, in taking action on climate change. So far from exacerbating those problems, this is a group that can lead society towards solutions. And I'm just very impressed at the work that you all continue to do, and do it in partnership. The picture that you're looking at is actually my backyard in early September. The wildfires in California and Oregon were so extraordinary that one day we woke up and the air was orange. It was a toxic orange that lasted all day. The sun never really came up. The street lights were on as though it was dusk. And it was so ominous, and just, again, a stark realization of the world that's at play with the pandemic, with the social unrest, and with the impacts of climate change all coming together in many ways in that one day. And so I just share that because, again, the work that you all are doing, and doing so well, is more urgent and important than ever. So Kaiser Permanente, in the midst of all that, in September, did achieve carbon neutrality, and that it was no accident that they were able to announce this work in September in the face of everything else. It was to make a point that climate change is related to these other ills that we're facing, and that action can and must be taken. And their action was really significant. It represents 800,000 tons of a carbon footprint annually, and they're certified through the Carbon Neutral Protocol. I do want to make a point, because it'll tie in a little bit later, that this carbon neutral reflects emissions that are direct emissions, like from boilers and chillers in the hospital. I know most of you are familiar with the various scopes of emissions, but it's the scope 1, which is the direct emissions. It's scope 2, which is the purchased electricity, and a little bit of scope 3, which the company doesn't have direct control over, but things like corporate travel. So those are the 800,000 tons that Kaiser Permanente neutralized. They neutralized it in 3 ways. One was a lot of on-site solar installation. Another was through power purchase agreements for new electricity generation. So big wind farms and solar arrays were part of this mix. And then the purchase of carbon offsets for natural gas emissions. And what was unusual about that purchase of carbon offsets is that the decision was made with a focus on which offsets would have the greatest community health benefits. And so there were learnings there that were important. This was all the culmination of a multi-year strategy. It was announced in 2016 to be carbon neutral in 2020, and a whole host of other strategies came to play. A longstanding commitment to having new facilities LEED certified. Kaiser Permanente opened the first LEED Platinum hospital in California in 2017, had the first solar microgrid in a California hospital. So many, many innovations contributed to this. Now, let me advance. Gosh, I'm too quick on the draw here. I am not going to go into this slide in any great detail, but I did want to make the point that the scale and scope of sustainable healthcare is extremely broad. I have bucketed it into 3 categories, one being operations. So that is the scope 1 and 2 emissions. It's having food systems that are not just nutritious, but sustainable. It is about getting toxic chemicals out of products that are used in medical care and in building products. It's zero waste, et cetera. So that work is ongoing, extremely important. You all are experts in that. On the right side, there's clinical care, and I know we'll be talking about some of these more later. The offering high quality, high value care is a climate smart strategy. It's, it's a focus on prevention rather than treatment of illness. And these are things that, every surgery, every prescription has a climate footprint. And to the extent we can make sure that all of that is done in the highest quality way, the highest value way for society, and a focus on prevention, not just treatment, that's where clinical care becomes so important. And I mentioned earlier about, social injustice and inequities in care. It's through clinical care that disparities can be eliminated. There is no reason that a population, just because of their demographics or race, should have a different health outcome than any other. And that is directly connected to access to care and the kind of care that's delivered in a way that eliminates disparities. And I think we will talk more later about anesthetic gas, but eliminating desflurane has been something that Kaiser Permanente has worked very hard on. And what I love about that is that it is led by clinicians. So, sometimes the sustainability work feels like it's led by operations, not really with a clinical bent. There is so much that clinicians can lean in on. And this is one great example. When you tell chiefs of anesthesiology that substituting one gas for another can make a huge difference to climate change, that's where the conversations get really exciting. And then the third bucket is around leadership. And as Ian mentioned, the hospitals are anchors for community jobs. They can buy local, they can buy from minority-owned businesses and truly change the dynamics of a community. Clinicians and healthcare leaders can educate patients and the public. They can get involved in advocacy work, in grant making, in research. So there are a whole host of things that can be brought by healthcare systems into this mix that really involve everyone in the organization, not just the sustainability leaders, of course, not just the folks who are so capable around managing energy, but you can see the scale and scope of the work is truly sweeping. I wanted to maybe share some of the lessons that I've learned over the course of this work and in terms of what actually creates change. And it falls into these three categories. I mean, first, this group is a fantastic example of collaboration, and collaboration is completely essential for accelerating success. Like your partnership, when I was with Kaiser Permanente, I worked closely with other health systems and NGOs like Healthcare Without Harm. But the lesson I would reflect on right now is in the early years of that work, we took years to make changes that today need to be made in months. The successes today have to be built upon by others. It cannot be a learning curve that's repeated over and over again. We have to flatten the learning curve. No one needs to recreate what it takes to become carbon neutral. We can't afford the time. We have to start where others have already arrived. And the only way to do that is through collaboration, much like the one that you all are part of. The second learning I've had is that, it's important to have a vision and a vision statement and goals and ideals, but those things don't achieve anything without getting down to brass tacks, being very practical, cost effective, having common sense strategies that can be sustained over time. A declaration to be carbon neutral or any other aim has to have the expertise and the details behind it. And I know from my own experience that that's very hard to do. It's easy to say you're going to aim for something. It's much harder to get there. And understanding that at the very beginning and getting that expertise in place is critical. And then the last kind of change lesson that I reflect on is there often seems to be a dynamic where people don't believe this work is consistent with quality, affordable healthcare. And I would like to say that there are mountains of evidence that in fact sustainability is completely consistent with quality, affordable healthcare. And we can simultaneously improve human health and well-being while eliminating the causes of climate change. Climate action is also completely consistent with healthy, strong economies. It's never been more evident that not addressing climate change will worsen human health, the economy, and undermine the fabric of society. So we must make these points and be transparent with information so that that point is well understood. And the last slide I wanted to share with you is to talk about what I think is the big next move, and that is commitments and action to be net zero carbon. And so maybe I could take a moment to talk about the difference between carbon neutral and net zero carbon. They're part of a continuum. The key differences are in how the target is set, the types of emissions that are targeted, and the methods to achieve success. So I'll just quickly go over each of those. First on the target. So carbon neutral, as I explained for Kaiser Permanente, is calculated on an organization's baseline. So the 800,000 tons of emissions that Kaiser Permanente neutralized is how that target is set. Net zero, on the other hand, is a science-based target. It means, and I know many of you know this, so forgive me, but I just want to be sure that we're using the same language. Net zero means setting greenhouse gas emissions targets that are consistent with limiting global warming to 1.5 degrees. So if all emitters globally enact measures toward that target, then the worst consequences of climate change will be avoided. The second key difference is that carbon neutral is mostly focused on addressing emissions that are under a company's direct control. So the chillers and boilers, the purchased electricity, the scope 1 and 2 that I mentioned earlier. Net zero carbon includes those, but there's a third type of emissions that's much harder to get our hands around, but it is many times greater than scope 1 and 2. And those are the emissions that are indirectly caused by an organization. This is primarily in supply chain and in investments. So you think about a computer that you use, the scope 1 and 2 emissions come from plugging it into the wall. The scope 3 emissions come from where that computer was manufactured. If it was manufactured in a location that used a lot of coal-fired energy, then it has much greater emissions than a computer that was manufactured using solar. The other thing related to targets is that net zero allows only a very limited use of offsets. So the carbon offsets I mentioned that contributed to carbon neutral at Kaiser Permanente would not be allowed under a net zero carbon system. It means you actually have to figure out how to run a hospital without natural gas. And then the final difference is in the methods to achieve success. So influencing supply chains, changing investments. This requires new partners, new partnerships, new expertise in the organization and through advisors. Those are all areas where we have to learn how to flex our muscle to achieve net zero carbon. So it is only possible, as you can tell, to achieve it through collaborations across the sector. There's no way that each hospital system could approach suppliers separately, for example. And it's not just within a country, but this has to be done on a global basis. So it's essential for systems and partners and experts to work together to achieve net zero carbon. So that's what I wanted to share with you and hopefully engage in some dialogue with you all as the program unfolds. And with that, I will turn it back over to Ian. Thank you so much.
Thank you, Kathy. That was a great start from a number of perspectives, a North American perspective, and I think some of the really big issues. We now will step on to Fiona, and I'm going to pause for questions after Fiona and Andrew have spoken. So I'll ask Amandeep at that stage to take a look at questions that may have come from the audience by then, and we'll see if we can tackle some of those. But once again, it's a welcome back here. Fiona helped us a great deal with the forum last year, the work that the University of Toronto is doing in this space in bridging the gap, bridging all the gaps between academia and big healthcare and the general community. And from Kathy's overview, the two pieces in there which intrigued us, one was leadership, and we've asked Fiona to speak a bit to initiatives going on locally with hospital leadership. And then Andrew's going to pick up on a whole bunch of areas around operations. How do you operationalize some of these things? So Fiona, are you going to steal the screen away from me right now? Excellent.
I am indeed.
Good
Thank
job.
you very much, Ian, and thank you very much for that very hard act to follow, Kathy, but really helpful to introduce what I want to say to you today, which is to introduce, as Ian says, a local initiative that really aims at the two pieces that are incredibly complementary to the work that this group has long been championing. And that is to really push on the climate smart clinical care and the leadership piece. And that is not to say that that has not already been happening. There are a lot of clinical champions, but we need to move this further ahead. So I want to introduce this initiative. The context for this initiative is, as you say, as we've already just heard from Kathy, that the die is cast, the direction of travel is clear. In addition to Kaiser's extraordinary accomplishments and the next path that it is now tracking, the English National Health Service, which because of the structure of their health service is more analogous to our own, has also, as many of you will know, declared a commitment to net zero. It's a very ambitious commitment. It's by 2045 for scope 1, scope 2, scope 3, and beyond. It stretches beyond the greenhouse gas protocol into patient transport because it is trying to cover the entire scope of the emissions caused by healthcare. So this is the ambition that we know we are moving towards. And we're not lacking for ambition in the Canadian context, and the recent announcement by the federal government gives us more security that it isn't just statements and plans, but it is in fact strategies to get us somewhere. So we now have a clearer pathway towards our net zero ambitions and our 2030 reductions. But to this point, in Canada, we haven't seen certainly what we've seen in England since 2008, which is a recognition that the health sector is a sector like no other. It is not just a place where there's transportation emissions or energy emissions or infrastructure emissions. It is a place where those emissions come together in a very distinct and important way. And they come together in a sector that has tremendous social and economic leverage that needs to be used. So to this point, there's a policy gap. The ministries of the environment and the ministries of health aren't really seeing the health sector as a place to advance this agenda. I think an important exception, or at least partial exception, is British Columbia. This is a recent mandate letter. It's to one of the health authorities, but they're all basically similar. And what you'll note is that this is an interesting top-down direction from the Ministry of Health to the health authorities that they need to conduct their operations with a view to the targets and the strategies for minimizing greenhouse gas emissions and managing climate risk in accordance with provincial policy. Outside British Columbia, however, I think we are not in a place with significant supportive top-down policy direction to the health sector. And so we're in a place where we're working on change from the bottom up, if you will. And so this is the context for much of the work you're doing and for what I want to suggest is a very, very complementary strategy of the Sustainable Health System Community of Practice. So this is an initiative recently launched. It's a collaboration between the University of Toronto, the 7 faculties of health science at the University of Toronto, so that's medicine critically, but also nursing, pharmacy, dentistry, social work, kinesiology, and my own faculty, public health. And for the moment, the 12 academic hospitals that are affiliated directly through the Faculty of Medicine. So it is a coalition towards exactly what Kathy suggested, high quality, low carbon care. Now, the importance of this collaboration, I want to talk more about it, but 2 elements of that I'll introduce now are first, I would suggest, and I'd be interested in Ian's reflections on this, that the healthcare sector has not to this point been as actively engaged on this file as other elements of the public sector. The university sector has been very visibly engaged for 40 odd years. University of Toronto has a low carbon action plan. Many of you will know Ron Supporta, who's championed that. He comes from the hospital sector. But there is a capacity there and an infrastructure there that is helpful. The other thing that's perhaps even more important is that the healthcare sector is very committed to evidence-informed practice and evidence-informed policy. So we do need to advance the agenda for high-quality, low-carbon care in alignment with expectations that we will generate evidence in ways that speak to the health sector. So not just in engineering journals or sustainability journals, but in healthcare and health policy journals. So this collaboration then has significant executive leadership. On the university side, it's my dean, the Dean of the School of Public Health, and on the health system side, it's Andy Smith, the CEO of Sunnybrook. It's been championed from the beginning by Gary Newton, and Andy is determined that this issue will be brought before the CEOs on a regular basis, that COVID-19 is not permitted to avert our eyes from this continuing issue. It's also a good news story in terms of things that have been accomplished. So we're speaking to the Tasman CEOs again this Friday. And the people sitting around our leadership table are people who are not experts in sustainability, and that is by intent. So they are not the people in this room who actually understand how to do this work. They are the people, however, who are the chiefs of medicine, who are the chiefs of strategy, who are the chief nursing officers, who are the directors of information technology, who understand healthcare and healthcare's reform agenda and how to align the sustainability agenda with that. So the next thing that I think is important in particular about this complementary initiative to the work that you're doing is this pie chart that I particularly love from, again, the English National Health Service's commitment to net zero. This is them charting their expansive scope for net zero and where it needs to come from. So here's a very significant piece of the pie, the directly controlled issues of building energy, enormous potential to make change there, clearly lots of work to be done, and clearly a room full of people, virtually anyways, capable of driving us in that direction. But and I know you've also started to have conversations about anesthetic gases, particularly with respect to gas capture, but a lot of the issues here are, of course, in clinical practice. I won't talk about that, but I will talk about the other bullet there, which is metered dose inhalers. And then these other pieces of medicines and chemicals, the aspects of the supply chain that are very much of which are clearly about prescription. So the point of this pie chart is to reiterate the extent to which moving towards sustainable health systems will require the expertise in this room, but it will also really need quite a bit of clinical leadership and operational leadership in terms of service design and service delivery to actually move the needle. So this is another image that sort of says what Kathy has said, but this comes from across the pond. This comes from the UK Centre for Sustainable Healthcare. The important thing about this sort of driver diagram, which is about reducing carbon without reducing quality, perhaps it should say more positively, reducing carbon while improving quality, is that the things that it calls for us to do are absolutely, and I think this is an important point, these are, many of them, they are core to the reform initiatives within healthcare already. They are already what we are trying to do, and we need to align the sustainability agenda with the reform agenda for healthcare. So the image that I've just put up is an image of integrated care. So many of you will be familiar with the Ontario Health Teams and in other parts of the world, other initiatives that seek to create a more coordinated and integrated system of care that wraps around a patient, that is not just the acute, but moves deep into the community. We know that the single biggest driver of high cost use of healthcare is food security. So we need integrated systems of care that are population health focused, and can support people with lower acuity forms of intervention that are community-based, that are empowerment-based, and that's a core to sustainable care. That's an important part of how we're going to get to net zero. We also need to address the challenges of overuse, of overprescription, overdiagnosis, overuse of care. Choosing wisely, an initiative started in the US, which has spread around the world, has a significant footprint in Canada, is about the up to 30% of healthcare that is not needed or potentially not needed. Well, if it's up to 30%, it's not needed. And that means you're getting the potential risks of care without the benefits of care. So choosing wisely is not interested in naming this an environmental agenda, but many of us, and they also understand that it is part of how we move to sustainability. And other initiatives like social prescribing, which again are about mobile empowerment of individuals and community-based, less acute care. So let me give you the example of this, which is the metered dose inhaler. And what I want to talk about here is something that is, on the one hand, very obviously an example where clinical leadership is going to be required. So the English National Health Services has identified the metered dose inhaler. This is the puffer, the asthma inhaler. Some of you will have one, sometimes used in COPD, chronic obstructive pulmonary disease, but typically in asthma. And this is a very significant greenhouse gas emitter. It's estimated to be about 3% of the English National Health Services emissions, carbon emissions. So how do we make a more sustainable set of practices around inhalers? Well, part of this is about choosing wisely. So we do know that inhaler utilization is excessive. A lot of people are getting inhalers without an appropriate prescription, and it's not therefore appropriate for them. So this is part of the move to sustainability. We do know that an enormous number of people do not know how to use this technology, do not know how to use these devices. So an enormous amount of the harm to the environment is coming from the fact that patients are not empowered and engaged in their care. We do know that there are device alternatives. This is about prescribing different types of inhalers, particularly the dry powder inhaler. and having conversations with patients about this. And we also know that this is about recovery and recycling. So what you can see here is that this is a perfect example of where we're going to need significant clinical leadership, where we have already in the Toronto area significant clinical leadership, but it is also something that insofar as it will touch on in hospitals in particular, procurement practices, recovery and recycling processes, even here, something that must be driven almost to a very substantial extent by clinicians is going to require partnership across the aisle with the people who do this on a daily basis. So that's all I wanted to say, that this is, I hope, a complementary initiative that can bring up the other side to support our mutual efforts forward. Thanks.
Very much so. Fiona, thank you so much. And time to, and again, we'll pause for questions and comments in a moment, but without great pressure on you, Andrew, let's just see, let me get back up to presentation mode. Anytime you're ready.
Okay.
Oh, okay. Andrew, you're going to take your own slides. That's good. So the nature of this morning is big thinking, and we've heard that. And Andrew, you definitely known as a big thinker, but hoping that in your comments here you can bring these ideas into closer to the space of how do we operationalize these things. What does it mean on a day-to-day basis to the folks that you work with within a really large hospital system? So over to you.
And can you hear me?
Yes, we can.
Okay, so yeah, Andrew Blair, Sinai Health. I run several facilities within the downtown area and a couple of ancillary family health teams outside of the downtown area. And one of the biggest challenges with all of these areas is ensuring that we optimize the operations while also being fiscally responsible for that optimization of the built environments. As you can see on this screen, Sinai has multiple arms into the healthcare community. We've got our acute care building down at 600 University. We've got Bridgepoint Health, which we'll also talk about as a newer P3 hospital commissioned in 2014. We've got community and home care. We've also got family health team with infrastructure built to support their services in various spots in the city. And then we've got a large research arm, some of it within the built acute care hospital, and some of it specially built in research facilities just around the corner from us. So looking at Mount Sinai proper, the hospital, it's been going through continuous significant changes for well over 15 years. Master planning for the hospital has turned the hospital from a roughly 900 square foot building to a 1.3 million square foot building with multiple phases. And then we ran out of ability to continue to grow, and our final project under the master plan, what we call the phase 3A or Renew Sinai, has actually now retrofitting the building 260,000 square feet over a 5-year period. And we'll talk a little bit more about the challenges with a retrofit of that size. Bridgepoint and Mount Sinai merged in 2014. And with that merger came the brand new Bridgepoint Active Health building, a 680 square foot rehab and complex care center with a similar host of beds to the Mount Sinai, just different in nature, giving us a broader continuum of care that we provide our community. And then, as I stated, we do a lot of research through our Lunenfeld Tannenbaum Research Institute. We have several floors within the building that have been built out for research, but we also then expanded in partnership with Sick Kids and UHN to create the 25 Ord building, which is directly behind us. And that building is 125 square feet of animal facility, but it's also then connected to a family health and further research building we call the 60 Murray Street building. So to combine that ambulatory research facility is roughly 250,000 square feet, and again of various ages, some new, some old, but also various opportunities that have come with that build out. So as I said, Mount Sinai's been around for a long time. It's been built in the 1970s. It has gone through a lot of renovations, expanding all the way up to a 19 and a 24 floor building. But our current challenges are really with getting through, I call surviving the Renew Sinai project. Started in late 2017 and will continue on till end of 2022. It is over 100 phases of retrofitting within the building. It will give us an expanded OR, a fully retrofitted emergency department, a brand new ICU, a addition of 22 medical surgical beds, and a whole host of other internal retrofits, as well as the opportunity to replace some infrastructure. There are several new air handling units. There are heat exchangers that were added to the building. But with all of this new infrastructure, these new changes, also came the challenges of how we are actually going to operationalize these things and what it actually physically does to tracking and documenting baselines in the building. And that's been the biggest challenge. As we continue to make effective good change, we also then have to factor in the cost of these major renovations and the ripple effect it has in how we operate the building. Compounding on that issue at Sinai is that a lot of the legacy systems in the building were either had limited documentation and or were failing. There was a ton of legacy systems when I joined in 2018 that were literally on their last legs, and we've done a lot of work in the last 2 years to either plan to replace or figure out how to get back to its original capacity to deliver the critical care that it delivers. So coupling the old building and the old building syndrome of trying to retro commission systems so that we can then push forward the optimization of the building. We have this major significant capital project that also needs to keep moving, needs to connect into some of these systems and creates its own layers of complications. Not as difficult story at the Bridgepoint site, but also challenges there. Again, brand new facility, it comes with all the bells and whistles in technology. You would automatically assume that this building would be the pride and joy of greening healthcare and be at the top of the list for energy and efficiency. But in 2018, when I joined up and immediately submitted for Mount Sinai to join the greening healthcare team of hospitals, the data that I then submitted to greening healthcare showed that Bridgepoint actually was not doing well overall, that it was actually struggling to provide optimization and energy compared to its peers. And then that started me down a journey of why are we not top of the list of hospitals, and why are we not as a hospital doing something about that? So we've spent the last 2 years literally diving into the operations with the project team that run the building, and coming up with strategies to push the bar and get us closer to top 5 percentile of healthcare. That journey has been challenging because incentivizing the project team has been difficult. The project agreement of the time, and Bridgepoint was built with some of the older language and the older project agreements, really didn't give the base building team an incentive to make changes. They were meeting the PSAS, they were meeting the parameters of what they should deliver as far as temperature ranges and optimization, and they were actually even benefiting from gain share as far as what they delivered annually for energy optimization, because the target was set so high. So for me to convince them, to compel them to go after the low-hanging fruit, those very specific areas, the ambulatory areas, the office admin areas, turning lights on and off during non-use from patients or staff. Those were challenges that we had to really fight and advocate for, to get them, number one, to decide that they would take these things on, and then the language that we had to add in variations to get them to accept that change, and for us to accept the ramifications of those changes going forward, because they were definitely worried about penalties, and they definitely didn't want to give up potentially on the baseline reset that's this year, and what that could do for them in the future. So we had a lot of challenges just getting what should be the easiest no-brainer optimization changes for most hospitals. I think I've spoke at conferences and seminars multiple times about going after those low-hanging fruit, and in a building that I was running, we were not able to do that for several years. So I'm happy to say we finally have come to that reality. We've sat down many times and we've got them, our phase 1 of the optimization underway, and we'll watch and monitor and track those changes, and then continue to successfully try to push them to do more. Over at the main sites here on University, we have, it hasn't been that we haven't been able to do anything. We have definitely been able to do some projects. Again, we had several chillers that needed to be replaced. We looked to optimize and conserve energy in the newest technology. So we are successful in getting incentives and to replace those systems. Between the phase 3A project and my infrastructure renewal replacement plan, my 5-year plan, we've been able to replace almost all of the static motors in the building and go to VFDs. And so there was a great significant savings there, and some success in making sure that we had that variable control of systems. LED lighting is always a low-hanging fruit if you can make the case for it. And so where we strategically been able to do LED lighting, we've also been able to grab incentives and do that. And then we have a ground level food court that used to run 24/7, and now we've gone to an optimization plan where it's based on occupancy and CO2, and not specifically on 24/7 use of the space, which it was not definitely being used. So we've definitely got projects that were underway and or that were completed that show that we're trying our best to work around the complexities of all the other chaos going on in the building. But we have so much we can still do, and we'll continue to do as we move forward in the years to come. When I summarize the changes that we want to make, I always look to what are the things that we should be able to do relatively easy. Lighting and ventilation, they're always there. The opportunities are always there. If you have lighting controls in the building, there should be no reason why ambulatory spaces and admin spaces shouldn't be reviewed and adjusted. We've been able to do that now at both our research spaces and at the family health team spaces across the street, because those were out there, the technology was there, the ventilation was easy to set up, and we've been able to implement the changes. Again, we make incremental changes so that staff can accept that we're going to do these things, and then as they get calmed down to the affected change, we eventually continue to push the bar and move out the setbacks in time. Again, if you try to hit staff too hard, they instantly panic, freak out, and will actually make problems for you. But if you work with them, communicate with them the changes, and for our team, Tracy Clapworthy's been phenomenal at meeting with users, getting them on board with the plan, assuring them that we're going to monitor and make sure their spaces are safe, that they actually will work with us and allow these changes to happen without heavy resistance. What is next for Sinai Health? So we've been doing a lot of work, and Tracy's been an advocate on getting a green steering committee together with leadership from the highest levels. You guys have mentioned Gary Newton. Gary Newton is a huge advocate for green strategy, sustainability, looking at that whole spectrum from waste to purchasing practices right to energy and optimization. He's supported all of the ideas as we've gone forward on this journey, at least for the 2 years that I've been here. But he definitely is a supporter. We've had lots of conversations about how we can continue to implement change over time. The steering committee, we've just finalized what we believe will be the revamping of that committee to get leaders that can actually affect change in the areas that need to be changed. And again, both Fiona and Katie have highlighted on reuse, recycling, what we buy, how it's packaged. All of those teams from procurement and the support or environmental services really have to be at the table. It of course isn't only about facility operations and what facility operations does to optimize energy, but it's a holistic picture of how the hospital is operated and run, and how it's supported by all of those teams, and that they actually have some way to be incentivized, whether it's from credit from the highest levels or from dollars infused into their budgets to be able to implement these changes. Those conversations have to happen, and those teams have to be at the table to make effective changes in those other streams. And then we continue to optimize our BAS. Nothing is easy in getting your building sustainable from an energy perspective if your building controls don't work. So retro commissioning should be a never-ending cycle of activities. For me, it's a team. I look at my primary consulting engineers, my air balancing service contract, and then my facility staff on site. Together, we're constantly auditing, studying, and looking at how to make this building efficient, lean, and optimize it. So we'll continue to do that, not only here, but at all our sites. And we look forward to, in the years to come back and tell you about those successes.
Andrew, thank you. That's let me take the screen back right now. You've done an amazing job of taking the big thinking from the Kaiser Permanente system and the work that Fiona is doing, and starting at that level strategically within Sinai Health, because how could it be a bigger challenge? You've got the infrastructure project from hell, trying to get everything done within a constrained site, while you've got three other facilities to work with, getting it all the way down to the idea of simple retrofits. And as we hear more and more people talking, sustainability is a huge issue. Everybody's in it together, and it does involve clinicians and supply chains and procurement. But at the end, the work that you're doing, Andrew, and that so many Greening Healthcare members are doing, is at the practical, exactly what Kathy said, at the practical project level. Once we start getting a few things done, it's remarkably instructive and inspiring for everybody else.